One thing that I really try to hammer home whenever I talk about risk management for CRNAs is understanding the difference between standards of care and standards of practice. Those terms are often used interchangeably when there is a nuanced difference there. Knowing the standards of practice, those are put out by our member organization, the AANA. And those are practices that are expected by any CRNA in every setting that we practice. Even though we do different types of practices, our practice can vary from an outpatient GI clinic to heart transplant, liver transplant, or trauma surgery. Standards of practice are expected across settings. So that's things like pre-operative interview and assessment, or taking vitals a minimum of every 5 minutes. Certain things are expected across settings. Now, that's different from standards of care, which might vary based on a fact situation and the resources available. My classic example being the resources available to you in a level one trauma center for, say, heart attack or stroke victim. That's going to be quite different from what's available to you in a critical access hospital. So the things that are expected of you as a responding member of a code team to the trauma bay is going to be a little different than what's expected of you working in a critical access hospital with limited resources. So it's important to understand the differences between standard of practice and standard of care, and making sure that you know what's expected of you in your setting, which establishes the standard of care in that setting.